Hi, I'm Dr. Scott Bissell. I'm an orthopedic surgeon specializing in sports medicine. I grew up here locally in Tolland, Connecticut, where I went to high school. After I became interested in medicine, I returned back here to Connecticut to go to medical school at UConn. After finishing medical school, I went to orthopedic residency training in Rochester, New York. Following that, to further develop my interest in sports medicine injuries, I took an extra year of training, what we call fellowship, in Los Angeles, California, at the Kerlan Jobe Orthopedic Clinic. Sports medicine is a very broad area of orthopedics, but primarily focuses on the non-operative and operative management of injuries to athletes. Now, our definition of athletes is certainly very broad. You can think of the typical athlete, the NFL athlete or collegiate athlete, but a large part of my practice is also those what we call weekend warriors, those people who enjoy just participating in athletics on a day-to-day basis or choose to lead an active lifestyle and then have an injury or a problem that's keeping them out of what they enjoy doing. I believe strongly that our philosophy is to take good care of the patient from the first time they set foot in our office until we're done with their care. And I think that starts with our office staff, who we've carefully selected to be friendly and outgoing and to help people with paperwork and everything else that goes on before you even get to the doctor's office. We feel strongly about developing a personal relationship with our patients, getting to know who you are and what your goals are, and then trying to meet those expectations. My philosophy, in a word that I tell a lot of patients, is conservative, meaning that I try to maximize non-operative management before considering surgical intervention for almost every problem that we see. Now, that being said, if there's something that requires surgical intervention, we're happy to proceed with that on an as-needed basis. But again, I think the basis of my philosophy is to maximize non-operative management of injuries before considering surgical treatment. So I grew up in Tolland, Connecticut, and went to high school in Tolland. So I'm very comfortable with the area and kind of feel that this is my community and my home. So it's felt very comfortable for me to come back and begin practicing here. It's allowed me to become involved in a lot of the local community events, particularly, say, high school sports, cover high school football for Windsor and Windsor Locks, and it's also allowed me to become involved with some of the professional teams such as the Wolfpack in Hartford.